It is 4 o'clock. Welcome, welcome, welcome. I hope that you all are here, excited, just as excited as I am, to this 2020 Virtual Women's Forum. Today we have some very special guests. Dr. DeAngela Burns-Wallace will be joining us, and Miss Wendy Doyle. So before we get started, I would love for you to give your attention to Miss Glenda Washington.
There I am. Good afternoon, everybody. How are you? Thank you so much for joining us today. This is our second Women's Forum of the year. We have one in the spring and one in the fall. And so hopefully today you will be able to indulge in some great conversation about the strength of women during COVID. Wendy Doyle will speak on some stats about women. And so take note of that. I'd like for you all to be prepared to ask questions. She'll have 5 minutes to ask questions after her presentation. And then we will also have Dr. Burns-Wallace join us around 4:30, and she'll do a presentation as well. So one of the things that we're asking you is that if you have any questions, place them in the chat box, and Felicia will take those questions and ask whoever the speaker is at that time. So we have a full house today. There's about 95 of our closest friends joining us, and we certainly appreciate it. And hopefully this is one of the I would say Zoom chats, but it is not, one of the forums that you will really and truly get some information out of that you can take back to either your home, your business, or your workplace. We certainly appreciate you joining us today, and we look forward to having you interact with us again in March as we host the 2021 Women's Forum, Women of Influence. Hopefully we can have that face-to-face in a live format. We'll keep you posted on that and let you know what we are going to do.
Thank you, Miss Glenda.
I would like to check and see if Rachel is in.
Yes, she's in. This is Wendy. She's in.
Hey, Wendy, how are you?
Good. Nice to see you, Glenda.
You as well. So, Felicia, that's our speaker.
Hello, Wendy.
Hello.
So I'm going to take a chance, for those of you who don't know me, which is probably very few of you, my name is Felicia Glass, and I am going to be your host today. So I'm totally excited to be in this venue with you, and I am honored to have the opportunity to introduce to you Miss Wendy. So Miss Wendy advances all women's economic and civic leadership using evidence-based research and policy solutions to make meaningful change in the Midwest. Wendy's nonprofit career began as a national major gifts officer with the National Kidney Foundation Incorporated. She worked as a nonprofit consultant who focused on board development and strategic planning. She later served as the executive vice president of Catholic Charities of Northeast Kansas. Wendy earned a BA from Rockhurst University in Kansas City, Missouri, and she serves on the Missouri Women's Health Council, the Missouri Foundation for Health's Missouri's Opportunity Incubator, say that fast 20 times, a Junior League of Kansas City, Missouri's C3KC advisor, the University of Missouri Kansas City Star Education Committee, and Park University's Civic Advisory Council. Welcome, Miss Wendy Doyle.
Thank you for that warm introduction, Felicia. And a big thank you to Greater Topeka Partnership for having me today. I am so honored to be here virtually with all of you. I wish we could be together in person, and certainly honored to be here prior to Secretary Burns-Wallace. What a treat it will be for you to hear from her as well. We have several slides that we're going to share with you today, and my colleague Rachel Holloway is joining me, so we're tag teaming today. So please let us know if you can't hear us, but we will be walking through the presentation. The first thing I just wanted to do is to share a little bit additional background. I know so many of you already know the Women's Foundation, but our mission really is working to advance all women's economic and civic leadership. We're statewide in Kansas, do lots of work in Kansas, also do similar work in Missouri as well. Our vision really is we envision a world where all women are empowered to strengthen our America's economy and democracy. And we really believe that when you invest in women, everyone benefits, everyone wins. So we have women in our name, but our work really is to strengthen, strengthen our communities and our state and for everyone. What you see here on the screen is that the Women's Foundation is, our foundational principle is that we really build everything off of research and data. And what you see here up on the screen is some of the significant research studies that we have invested in over the last 7 years, and over 18 policy briefs and significant research studies. And we utilize the research to identify economic barriers, to develop solutions, and work hard to get results for women and their families. We've had a great research partner with the University of Kansas, respectively, for our work, and we look forward to continuing that partnership. This year has been extremely challenging and a reminder of the importance of our work. COVID-19 has significantly hit our country hard, and as we all know, is disproportionately impacting women, ranging from small businesses struggling to stay open, to the moms juggling full-time work with full-time childcare, to single moms who don't have that luxury of childcare or of working from home and lack paid leave. It is really no surprise that the majority of service industry workers and healthcare providers serving on the front lines are women. When COVID-19 stay-at-order happened, the Women's Foundation quickly pivoted, like most organizations. And one of the things that we wanted to understand is we were hearing across the country of how women were significantly impacted, but we really wanted to look at and ensure that we understood what was happening here in our backyard in Kansas and Missouri. So we invested in what we're sharing with you today, a COVID-19 data dashboard that really helped us understand the impact of this significant epidemic. So for today's discussion, the data that we have pulled out of that data dashboard is focused on Kansas. Here's what we found. We too, as it was the national wave and the discussion point was actually happening too here in Kansas, that women disproportionately were suffering from the economic impact of COVID-19. Our research really identified there is significant impact to women in healthcare professions, service occupations, and caregiving roles at home. And I'm sure there are lots of nods, particularly with that caregiving role when COVID-19 happened, with children being home from school, not only juggling, trying to remote work into work, having that luxury, but also having to be a teacher to your child. So COVID-19 really was disproportionately impacting women. Our research also identified that the COVID crisis has brought equity issues such as pay equity, paid family medical leave, and flexible work options really to the forefront of conversations and discussion points. It also highlighted pronounced inequities that women of color experience on a daily basis. And so again, this research and data dashboard that we put together was really creating that conversation of, we knew this was happening, we know our research has proved it in the past, but now with COVID-19, it's even a greater impact. We know that everyone is feeling it, the impact of the health crisis, but women shouldn't have to suffer disproportionately. Policymakers, it is our intent that they should prioritize the needs of women and their families in their recovery plans. The state-specific data that we're going to cover today really underscores the need for a couple of key policy priorities the Women's Foundation has been leaning into, which is paid leave, pay equity, and reducing red tape for professional women in the workplace, but also women business owners, which really leans into the occupational license space that we've been working on. These changes will really help ease the burden on women and set the stage for a more economically powerful future for Kansas. So before we really jump into, the data that you're going to hear about, and you're going to walk away today feeling like a data wonk, I really wanted to set kind of a baseline of, what was happening pre-COVID. So before I dive into that, we're going to walk through a couple of key points. Healthcare workers on the front line of the pandemic. Our research shows that nationally, women serve as more than 75% of the healthcare professionals, 85% of support professionals to the health sector, and 55% of service sector workers, such as working at a hotel, working at a restaurant, 55%. In Kansas, specifically, those numbers for women increased to nearly 78% of healthcare professionals. So again, we were benchmarking against the national trend of 75%. We have more healthcare professionals than what's happening nationally. 88% of healthcare support professionals, such as technicians, and 60% of service sector workers. So the trends that we really identified is what was happening nationally was happening more in Kansas. In the majority of the professions in Kansas, women earn 80 cents for every dollar a man makes for the same work. And for service sector workers, most did not or still do not have access to paid family and medical leave. The gender gap is even worse for women of color, and benchmarking in the state, it widens as much as 65 cents on average for every dollar a man makes for the same work, including the healthcare sector. In addition, while women are on the front lines of responding to this pandemic, they were absent from really making decisions about how COVID was really impacting, yet women are disproportionately impacted. Yet where were they at the decision-making table at the city, state, and national level? So something that we look forward to hearing additional insights today from Secretary Burns-Wallace. But this gap really underscores the importance of expanding the pipeline of decision makers, of civic leaders, and creating processes and accountability measures to ensure that civic boards and commissions really represent the community served, our population served, and never again should we be hamstrung by a lack of diversity. So one of our solutions that the Women's Foundation has worked on, and we have a couple of appointees in the audience joining us today, so thank you for your leadership and your service. Our appointments project facilitates the appointment of women in civic leadership positions at the city, county, and state level, and thereby addresses a critical gap in representation and leadership. And just to share, we have had great relationships in the state of Kansas at the city, county, and state level, but we are expanding per our strategic plan outside of our Midwest borders and looking at how we can share this best practice across the country. So far, the Appointments Project has facilitated the appointments of 130 women, including 28% women of color. So we again want to see this trend, and I think I want to do a shout out at this moment that everyone in the audience, if you haven't considered it, please go to our website and learn more about the Appointments Project. It's a great way to give back to your community and really be at that decision-making table, making decisions for yourself, for your family, and your community. Now, I'd like to shift now and get more into the specifics from this data dashboard that we created. Our partner on this is an organization called My Sidewalk. And this dashboard, what we love about it is updated in real time. It is accessible on our homepage, which is womensfoundation.org. So we're going to cover some key topics today, but just know there is lots and lots of information. So I encourage you to, if you have the time and interest, to please visit our website. I will say that the dashboard is even specific down to your specific county, and so you can get information that's really relevant to you. This dashboard it really spans across several things as it relates to the COVID-19 cases. So it's up to date in real time on COVID-19 cases that are being reported in Kansas. Women on the front lines in the fight against COVID, talks about the gender pay gap, and women workers that are hit hardest in their specific industries. And then we really wanted to do a temperature check and understand what was happening with our women business owners, and certainly the impact on families, grandparents, and a lot more. So the first thing we're going to focus on is healthcare. And we talked about the healthcare professionals, and in Kansas, 8 in 10 healthcare workers are women. And many in rural counties represent as much as 90% of the healthcare workforce. So despite being the foundation of our healthcare response team to the coronavirus, women through this research in Kansas are still paid less than men in the healthcare occupations. This was a key point that really jumped out at us. You know, we thought it could have been in some other industries, but we really took a look at this as it was impacting healthcare workers. And so, for example, registered nurses in Kansas make 80 cents to a male nurse. And that shouldn't be, you know, especially since women are really, you know, are the caretakers for their families. And the gender pay gap is across all sectors of the healthcare industry. So it's not just nurses, it's physicians, physician assistants, and healthcare support workers. This is really, you know, vulnerable when you have these economic downtimes and women are paid less than their male counterparts. And then, you know, taking care of their families. This is a significant impact that we are seeing, and something the Women's Foundation continues to lean in. So a solution that we really bring to the table is that we are advocating for banning salary history from employment applications as just one solution, a very simple solution of closing the pay gap between women and men, and really trying to take care of our healthcare workers. So for those in the audience and you have some influence, or you could have a conversation with your HR departments, just go and say, can we ban salary history from an employment applications as just a really easy solution to even up the playing field. The other thing that we have done is that we established pay equity best practice guidelines to really create equal pay for equal work. And this was really led by initiative of Missouri Governor Nixon in 2015. He signed an executive order and said that very thing. Women's Foundation, create the best practice, pay equity best practice guidelines for us to understand what we can do. And there are tools in there such as just doing an audit, analysis, having paycheck transparency. And again, you can access this on our special research project. You can access it on our Women's Foundation's website. Some barriers to healthcare. In Kansas, about 1 in 10 individuals lack access to health insurance, putting them at risk of getting good quality health insurance, and certainly something to be concerned about COVID-19. 20% of our Kansas population is without health insurance coverage. Really see that a trend line in our rural communities when there is limited access to healthcare, to hospitals, intensive care beds. And for many women, affordable healthcare is immediate concern. We know this because we've done listening sessions to understand what are the key barriers that are holding women back economically, and they certainly have healthcare as their number one. They always want to make sure their children are taken care of, but when it comes to their own personal care, they will certainly put that on the back burner to make sure their family's taken care of. We also know the trend line that women live longer than men. So healthcare concerns about if I live longer than men, which is 7 to 8 years longer, that aging and health-related challenges go hand in hand and were also identified. And certainly we should point out and know that women of color have even more pronounced health challenges when they don't have consistent access to health care. So again, we're seeing some significant healthcare barriers that have come to the forefront as a result of the COVID-19 crisis. I want to shift quickly to service industries. And again, this is your food preparation, your housekeeping at hotels, personal care services, really significantly impacted those hourly wage earners. So while women represent around 47% of the labor force nationwide, in Kansas, it's about 56.4% of the service sector nationally, and looking at 59.2% in Kansas. So again, service sector employees, those hourly wage women that are serving us, really impacted by the COVID-19. Some solutions the Women's Foundation has really been working on is the occupational licensing for all professions, looking at reciprocity, ways to untangle red tape. We know that women hold a professional license at 2/3 of a higher rate than men do, so it's something that we will continue to lean into. Women-owned businesses certainly impacted by COVID-19, and the National Association of Women Business Owners cite there are 11 million women-owned businesses in our country, which is employs nearly 9 million people. So women, we really are becoming the entrepreneur driver for our country. In Kansas, women own about 7.6% of all businesses in Kansas. So again, women in Kansas are responsible for a significant amount of employees and payroll in Kansas. And so what I'd like to say to everyone here participating is that, Greater Topeka Partnership participants, we need to be supporting our women-owned businesses. And as women, we have a key responsibility to support one another, lift each other up, and support other women. Childcare is, really highlighted as a result of COVID. As we had cited earlier in the presentation, that once children, schools were closed and everything was virtual, that saw a couple of things. One, access to broadband service, isn't accessible to everyone, and certainly in rural parts of the state. But the child caring and teaching and keeping children learning to complete the school year really fell on top of women. So a key point to note here in Kansas, 1 in 5 families are single mother households. And throughout urban and rural parts of Kansas, grandparents in particular are living with and in many cases responsible for their grandchildren under age 18. I really want to put a face to this because this is a key point. We talk about women aging, women now, living longer, grandmothers are being responsible for grandchildren. You can see the ripple effect and the economic burden that this plays. But there are about 160,000 grandparents in Kansas that have children living with them, and 70,000 grandparents that have sole responsibility for their grandchildren. It's a significant number in Kansas, and something that we all should keep in mind. And it's a significant economic factor that we should all be paying attention to. We also saw as a result of COVID that women were having to reduce the number of work hours that they were working because they couldn't juggle childcare and doing their job. And we hear this daily from women that are reaching out to the Women's Foundation that some are not even able to go back to work because of the childcare, which means that the economic ripple effect is not supporting their retirement or their savings plans. And this is a critical issue for the state of Kansas and something the policymakers must keep in mind as they are thinking about recovery plans. The McKinsey Institute found that Kansas economy stands to grow by about 15% by 2025 if women continue at the pace that they have prior COVID-19 in the workforce, starting new businesses. We have the potential to be the economic engine that really drives Kansas forward. But we need to ensure that women are not encouraged to pull back because of lack of flexible work policies and supportive policies, lack of occupational licensing policies in place, or creating red tape that discourages women from launching their business. So paid family and medical leave is a key issue that Women's Foundation continues to lean in. We see this as a key strategy around the economy. The United States is the only industrialized country that doesn't have a mandated paid family leave policy. So the Women's Foundation is committed to continuing to advocate for this. And in the state of Kansas, just as a refresher, one key thing that we did when Governor Collier was in office is work with him on Executive Order 18-19 for 17,000 executive branch employees in Kansas to have 6 weeks off for the birth or adoption of a child. So we're really proud and we'll continue that. We know that as we're kind of closing out here, that this is we have a lot of work left to do. That this is, you know, COVID-19 really highlighted, as we have talked about, some key issues that are important to the foundation, but really brought to the forefront and to create a more interesting dialogue that we could have with policymakers. Again, you know, what we saw, we all took advantage of through the CARES Act is immediately a federal mandate for everyone to have the benefit of paid family and medical leave with 12 weeks off, but we want to see this become a more permanent solution. So in closing, you can see how COVID, as I've just highlighted, has underscored the importance of our work. You have our commitment that we will continue to advocate for the relief and support of women and their families in the days and months ahead. I encourage you to stay connected with us, really check out the COVID-19 research. Again, there's more information there that you could ever want. And on behalf of Women's Foundation, I hope that you and your families remain safe and in good health. I know we have just a couple of minutes for questions before shifting to Secretary Burns-Wallace, and I'm happy to answer them. Thank you.
Great presentation. Thank you. So much information there. I don't know about you all, but I was in here shaking my head and like, oh my gosh, I can't believe that. But some of it is not a surprise either, right? So I will throw a question to you. It says, beyond banning salary history questions from the job applications, what does the data show in terms of reducing the pay gap when salary ranges are a part of the job posting?
Yes, absolutely. It's a great point. It levels the playing field. We don't have like a research study that really demonstrates how much that kind of shores up. I will say that since we have conducted the status of women in research, or status of women in Kansas research study in 2016-17, we closed the pay gap in Kansas by a penny. A penny. So we have a long way to go, but it does help. And that is a great, easy solution to, you know, posting the pay gap. And so it's not relying upon how much were you how much were you previously making to the conversation. So it helps level the playing field. Another strategy is paycheck transparency, which we would love to see, at any time, if you wanted to know what your male counterpart was making, you could ask and not have retribution for that. But we're a ways away from that piece.
Quite a bit.
Quite a bit.
I would also like to ask, have you considered banning race from the application?
Yes, that's a great question. We, of course, I think is anything that we can do to promote how we can do a level set between women and men and creating, equality. We certainly want to do that. So it's something that we don't have any research to back that up, but we should. And it's a great point, great question.
Great. Well, Wendy, I would like to thank you. I'm sure everyone in the group would like to thank you for that very informative presentation that you provided us. And ladies, please make sure that you check out the website. Wendy, can you give us the name of the project again?
Sure. It's women's-foundation.org. We'll put it in the chat box. And on the front page of our website, you can click on the link of COVID-19 data dashboard.
Very good. Thank you. Ladies, I know that ladies and gents, I know that there are several other questions that were given, and we can send those on to Wendy, maybe for some feedback at a later time. All right, we're going to move.
Yeah.
You're welcome, Miss Wendy. We are going to move forward and prepare ourselves for Dr. DeAngela Burns-Wallace, our Secretary of State here. I'm going to have to move something in my screen of administration, I'm sorry. So I can do her introduction. Prior to Governor Kelly's appointment, Dr. DeAngela Burns-Wallace served as the Vice Provost for Undergraduate Studies at the University of Kansas. Dr. Burns-Wallace started her career as a Foreign Service officer with the U.S. Department of State. She served foreign service tours in multiple countries. She is also trained in French and Mandarin Chinese. Dr. Burns-Wallace has been selected for various leadership opportunities, awards, and honors throughout her higher ed and government career, including being selected for the 2019 Leadership Kansas cohort as a 2013-14 American Council on Education Emerging Leader and as a University Invocation Alliance campus leader, participating in the 2018 White House Champions of Change College Opportunity, and earning a Superior Honor and 3 Meritorious Honor Awards from the U.S. State Department. Dr. DeAngela Burns-Wallace, we welcome you and we look forward to what you have to share with us today.
Wonderful. Good afternoon, everyone. How are you? We there? I'm looking for heads and nods. All right. All right. I'm gonna move this over. I can't see everybody's faces, so I'm making the PowerPoint a little bit smaller so I can see faces. Can we take that down? I hate seeing my bio up there. That's all the stuff that I've done. So thank you all. Oh,
Can we put her face up red as speaker?
That would be great. And take down the PowerPoint.
Mm-hmm.
Thank you. All right.
There you go.
Wonderful. So good afternoon. Thank you so much for this opportunity to join you all and to have this conversation. When they reached out, they said, okay, we want you to talk about leading under, crisis and crisis situations. Let me turn off my email because that thing is going to bing all afternoon. And so I sat there and I thought, I was like, okay, this crisis, the last crisis, the 3 before that, or the one last week with my 11-year-old son, like, which crisis, where do we start, right? But it's such a, what are the words we keep hearing? Unprecedented and, these monumental times and all of these things that we sit in. And so it makes you sometimes take a moment to say, okay, how do we do this? Or how do we be successful? But part of that doesn't start here, right? We actually, when we lead during a crisis, we learn that through being ready. Because to lead through a crisis means that you've actually prepared. You've had and taken the opportunities to manage, to delegate, to question, to listen, to build. And you've done the work. So when the crisis happens, you're ready. Preparation, opportunity, readiness. So for me, when I started to put together my thoughts to really think about what leading in a time of crisis means, COVID-19 is a unique crisis. And it is one that this pandemic is something that all of us are facing in various ways, professionally, personally, no matter which way you turn. So it's unique. So I pushed myself to think back across my career into other spaces to see, how did I get ready for this time in this moment? So I thought back, and in different pockets of my career, there have been some really unique opportunities. And many of those opportunities have come about because of being prepared. Being able to, I hate to say lean in, but this idea of stepping into roles and opportunities, sometimes when it's your job titles and sometimes it's not, because I knew I needed the experience. I wanted to see how that worked and how that played. During my time with the State Department, I was the deputy press attaché in Pretoria, South Africa. I remember the night we were in the embassy, and I was the deputy attaché, but I had an amazing female boss, Judy Moon, who every time a call came in, she said, whoever picks up that call, I don't care how big the issue is. I don't care if it's the ambassador, I don't care if it's DC. If you pick up the call, that is your issue to run until it's done. On the night that I picked up the call, we were told President Bush is going to go on national television and say that we've invaded Iraq. All embassies are going to go on a 48-hour lockdown, and these 5 individuals will need to stay in every embassy, including a press attaché. That was me, but I was a deputy. But in that moment, being in that space, she had helped to lift me and prepare me. There wasn't a moment where she would say, I'm the senior deputy attaché and the senior attaché and you're the deputy. And so you don't get the opportunity to have this conversation. I was in every pocket in every moment that she was, and leading in my own parallel to her every time. So when this incident happened and we were in the embassy and they were throwing Molotov cocktails at the embassy because Nelson Mandela had come out to say that we were warmongers for invaded Iraq, there were real conversations that were happening about our relationships, about our resources, about the potential for evacuating our staff, about how we were going to bring voice and represent the US government. And sitting at that table squarely and being prepared to be at that table and given the opportunity in preparation was key and critical. So I thank her continuously for that. And I've used that example along the way to try to open that door to give others that same opportunity. I think about my time in higher education. I was at my alma mater, Stanford University, then moved to the University of Missouri and eventually to the University of Kansas. One of the most critical times that I saw in higher ed, and one of the most difficult times, many of you remember students across the country on higher ed campuses raising their voice around issues of race and justice and inequity. Similar to what we've seen over the last few months, but particularly in those college environments. If you follow the time, this was in late 2015, a group of students on the campus of University of Missouri brought their voice very loudly, and one of those students, a graduate student, went on a hunger strike. At the end of that hunger strike, when he came off that hunger strike, the president of the system and the chancellor of the University of Missouri both resigned. And I do believe the institution began to really embark on a journey of changing some of the systemic issues that plagued it. During that time and being at that university, I was an assistant vice provost for undergraduate education. And the young man that was on the hunger strike had been one of my graduate assistants the year before. And the other 12 students who were alongside of him protesting, camping out, keeping him safe during that time. Of the 12, 7 of the 12 had worked for me at some time during my time at MU. They were my students. They weren't just any student. Those students brought voice. Those students challenged the administration. Many of those students had worked with me in various capacity because the work that I was doing there was around access and opportunity. The work that we were doing there was about breaking into new models, thinking outside of the box around what we were doing and how we were looking at higher education in Missouri and who was accessing that higher education and how successful they were when they came into our environment. Our work was intentional. Our work was risky, but we were doing the work. When the students went on the hunger strike, I remember the morning that he came off of that hunger strike. I remember being pulled into a conversation with about 5 leaders. And now I'm an assistant vice provost. So you have the provost, you have the president, the chancellors, you have the vice provost, because I was an assistant vice provost at that time. And you have the deans. But at this time at the University of Missouri, across all of those levels that sat above me, there was not a person of color. So they came down 3 levels to get me, to bring me into a room to say, well, what are we gonna do? Well, my question was, why are we asking that now? And my bigger question was, and who are we going to be as a university in this moment? When those students took their voice to making this place better, what are we going to do in the seats that we sit in the leadership pockets and the areas that we hold to match their voice to say that we're going to make it better? Now, I will be very transparent. I had already accepted a job at the University of Kansas, so I may have been a little bit more vocal in that moment than I would have been previously. But if you know me, probably not, right? Because asking those questions, being a little bit risky in some of our defining moments of crisis are key and critical. And when we lead through crisis, we can't lead with fear. It has to be based on data. It has to be based on vision. It has to be based on the people that we must serve and protect, as I sit most of my career in public service. But it cannot be rooted in simply a fear of what may happen. Because in those crisis moments, the strength is in the vision. The strength is in the direction setting. The strength comes from the confidence. We sit right now in COVID-19, and as a state leader, there's been a lot of decisions that we've had to make. Some of them not as popular. Some of them people have agreed and disagreed with. But all of them are decisions that had to be made in different pockets and different places. For me, in every decision we've made, particularly as I influence and support the over 18,000 state employees, I ask questions about how is our staff doing? What is it that they need? Are my decisions impacting them in a way that is protecting them, that is supporting them, that is leading them? Because that definitive leadership is key and critical to build trust, transparency, and that relationship that is actually key and critical in this crisis. I have town halls with my teams on a regular basis. They ask me a question. If I know the answer, I tell them. If I don't know the answer, I tell them I don't know the answer. Because I need them to know that I don't know, but I'm working on it, and I hear you, and I understand, but I don't know the answer. But I also stand firm in my answers and decisions to say, we did hear you, and we have taken it into consideration. And the decision that I come out with, you may or may not agree, but I want you to understand how we got here. Those things sitting in the moment of crisis are critical. But at the end of the day, the strongest skill that you can bring to leading through crisis is grace. You have to have grace for your teams and what will work and what may not work. You have to have grace for those that disagree with you and understand their position. You must have grace for those that you represent and that you have to support, because they won't always understand, but you still must represent them. And most importantly, as a leader in a moment of crisis, you must have grace for yourself. That grace to say, I need to be able to pick up the phone and call that girlfriend, that colleague, my mom, whoever it takes, to make sure that I'm sitting in a space both personally and professionally, where it's solid. That I am taking the time to replenish myself, to pour back in, so that I can be all of those things that I need to be in various pockets during that time. For me, I'm a single mother. I have an 11-year-old son. I have parents who live with me. And my dad is on dialysis and on the kidney transplant list. And my son sits on the spectrum and is an amazing, beautiful spirit with 4 tons of energy. So sometimes in my moments where I'm trying to direct, what are we going to do for 18,000 state employees? Did we get our IT networks up and secure and is everyone safe? What are we doing with the funding that we need to get out into the community to make sure the citizens are being taken care of? I have to give back grace to myself to say, I can breathe. And sometimes I'm not going to catch it all, but that's also why I surround myself with strong leaders, that I give them the opportunities to lead in their pockets. So when I do have to step away, I feel confident they have it handled. Because that is as leading in a crisis as much as you being there every single moment. So I'm gonna wrap this up by saying this: that vision, intentionality, direction setting, thinking outside of that box, bringing the confidence to be a bit risky, being prepared, and making sure you are pushing yourself when the opportunities come before the crisis to understand, know, and be present, but most importantly, with grace. So I see questions. Can we hop in there? I know we don't have a ton of time, but I'd love to take a couple of questions or comments or reactions.
So, can you hear me?
Yes.
Okay, so I have one person who says, not a question, but a thank you for your leadership.
Thank you.
The question that I did get is, what does state hiring look like as it relates to gender equity?
Good question. So what I will say is that we have pockets. And so we've actually worked with the Women's Foundation on a number of different things, and there's some more work that we're hoping to do. We have, I can't think of the numbers off the top of my head, but we have a strong percentage of women across our state agencies. Right now, we have a lot of them in leadership roles. If you look across the cabinet and the governor's office and many of those. What I will say is that some of the areas, and this is an initiative that we are actually working on getting ready to launch. I see my Director of Strategic Initiatives, Cami out here. She's waving. I don't know how well we're doing in promoting and having more equity across leadership, right? Across various agencies. I think we might have imbalances in certain job fields, in certain agencies and agencies type, and also at the varying leadership levels. So one of the things that we are getting ready to launch, and this is part of one of our conversations, we have another one coming up in another week or so, but we're looking at how do we create kind of something like a women's leadership forum in state government, where we're bringing together, you know, women leaders, up and coming leaders, those that are trying to build those skill sets and learn, to talk about being women leaders, to talk about moving through your careers. How do you negotiate your next position? You know, how do you position yourself to have these opportunities so you're ready and prepared for these types of things? And actually leveraging into the moment that we have so many senior leaders at the most senior level of that cabinet that are women leaders, but also they have a number of deputies. As I said, Cammie's on here, who's my Director of Strategic Initiatives, my Deputy Chief Information Technology Officer, which is my other hat, she's on here. My Chief Operating Officer in the IT space, she's on here. You know, and so we have a unique opportunity to leverage into this conversation at the state. What I would say is overall, if you think of our regular hiring numbers and just a straight flat percentage, we're doing good, but you got to get deeper than that, just whatever that X% is to see where we are, what roles are we in, what are those pay equity issues, where are we in terms of leadership pipelines across. And that's some of the work that we haven't done as much and we are starting to do. And as I said, the Women's Foundation has actually been a good partner in some of that.
Great. Thank you. I just want to
I see you.
say, I see Miss Glenda. Go ahead, Miss Glenda. Unmute yourself.
I actually want to ask about supplier diversity. I know that Rhonda Harris has been working on an initiative, and I was wondering what your position was as it related to supplier diversity.
Yep. So they have, Rhonda has been working on a number of issues in that space, including, I believe they have looked at drafting some possible legislation. I have appointed my director of procurement to be a part of that working team so that we can leverage into that conversation and look at some of the other models that we already have around that, make sure that we're setting it up for, if they are positioning it for us to put it in legislature, that there's, okay, this is how we can do it. This is how it can be implemented. These are the things, the unintended consequences, and how do we get in front of that so that we're being proactive around that. So we are dead in that conversation. As the Secretary of Administration, and because the state's Office of Procurement reports directly to me, we are serving in that kind of informative role of this is how we implement, and using models from other states and federal to say, this is how you would track that. This is how others in the region are doing that so that we can implement. And so we are in support of getting that work done and trying to make sure we're being a proactive partner. But I think that push is still going to come from Commerce and also others in the communities, various chambers of commerce, the Women's Foundation, and others that are helping to support that. I think COVID and even some of the data that Wendy shared is going to help inform and propel that as they put forth that legislation. So I look forward to seeing it.
I'm excited about it. I'm on the team with Rhonda, and we're working on it. It has been a long time coming, and we are so proud that we are at least introducing it and that you're supporting it. Thank you so much.
No problem.
Any other questions before we let her go back to work? Because I know your day is not done. Wendy's isn't either. Any other questions? We have a number of women on here. And if you would like to, if you have a question for Wendy, I know there were a couple. And then if you have a question for Dr. Wallace, Burns-Wallace, feel free. We got a couple of minutes. Feel free to ask those questions. You had a couple, didn't you?
Well, Glenda, there's a comment. There's a comment. And what she's doing is she's sharing that she had a situation with using FMLA for mental health issues. And so overall, at the end, her question is, how do we increase understanding in our workforce regarding mental health issues?
Yeah, that's tough. Some of the reality around the conversation is creating more inclusive workspaces overall, right? It's about making sure that we're creating spaces where people have a sensitivity to the varying issues and challenges that everyone is facing, but also ensuring that we recognize because there are challenges doesn't mean that people aren't effective and can't do their work or any of those types of things. And also ensuring that there are certain protections around them so that they can do that. Like that's what FMLA is for, and you should be able to do that without punitive, right? So it's twofold. I think there's a piece of it that's about culture and training and biases and working through people's understanding, but also making sure that our systems are in place that give that protection so that there can be, kind of retribution and things like that. Do we do a great job with it at the state? I think we do okay, but in pockets, we're not great. And I think that that's any organization. I think part of what is going on right now is actually pushing more of us as leaders to face these conversations, because it's not just a pocket, it's our entire workforce, right? And if you come in and you were working with certain issues beforehand, they're even heightened right now, and others are manifesting for people. And so it's a challenge in the moment, but it's both, right? We have to work on that culture. We have to work on that training, but we also have to ensure that those right. And this is where I know Wendy and them do a lot of work, making sure the right policies are in place, the right protections are in place, because you should be able to take that mental health day, right? You should be able to take that mental health day for your child and for yourself. And there shouldn't be a hint of fear about your job, but there also shouldn't be a bias around, well, if you need that, then are you going to work? Or FMLA is there for a reason. And because you go on FMLA does not mean that you can't do your job or you won't do your job. FMLA has a purpose, and we have to make sure that we are protecting that, and that we're not putting in policies or other things off the books that are counter to what that is designed to do. So,
Wendy, do you have any data around mental health in women?
It was interesting. I think the only thing to add, Secretary Burns-Wallace covered it really beautifully, but I will say that when we took the time it was more in the qualitative, the listening sessions, hearing from women, that this was really a point of concern and highlighted. So, there was lots of discussion about mental health and support and counseling. And you know what, it spanned across all income levels. And I would say who felt most comfortable talking about it was mid to upper income women, about the importance of, I need support, I want to have it. And where we saw in the lower income, it was kind of teetering on the fence, but it was more about their children and personal care. So no data to back it up, but really heard it loud and clear when we listened to women.
My other question is women and suicide as it relates to COVID. Has anybody talked about that or researched that?
We have definitely, we didn't specifically focus on that with the COVID-19 data dashboard that we put together, but we certainly know that domestic violence was on the rise. Suicide rates for sure, just really elevated and exasperated, just the what you would think. So we didn't specifically focus on that, but there is a little bit around the domestic violence that you can see in the data dashboard.
Wow. I'm going to piggyback Matt's word here. And he says 2 world-class speakers today. And you ladies definitely came through with the bang. We appreciate your words, and definitely your wisdom. Wendy, the stats are amazing. I thank you all for the research that you're doing and the work that you're doing to better the workforce for all of us. Dr. Burns-Wallace, your words were transparency and grace were amazing and heartfelt. And so we appreciate your just down to earth chat with us, encouraging us to take care of not just everyone, but remembering to come back and take care of ourselves. And being a mental health clinician, I applaud the statement. And that was actually my closing statement today.
Can I make one more plug? And so
absolutely.
So Wendy talked about the appointment project, which she knows I love. I'm a big fan of it. But here's one of the things I want to make sure, and we were talking about this because I'm actually doing another panel next week for Wendy around Ready to Run. Put your
unmute, Wendy. Unmute.
Yes, the Appointments Project and Ready to Run Kansas Women's Leadership Series.
And so the reason I mentioned that is because, and we had our prep meeting earlier this week. And so I'm going to make sure in every space that I am in that I do kind of walk the walk. So here are the things. 1, civic leadership is key and critical, and we have to be present and we have to bring voice. And with that, we both must lean into serving and serving, whether that means running or if that means stepping in and volunteering in various capacities. So I will say from my seat with the state, one of the things that I want to make sure people are aware of is that there are a number of boards and commissions that the governor appoints to every single year. There's an appointments page. You can go on there. You can list yourself. You can put your resume in there. There are times when we are not as forthcoming about promoting ourselves. This is that moment when we need to promote ourselves. We need to put ourselves in those databases, because when they go to search for qualified candidates for the boards and commissions, if we're not in the database, we can't be part of the consideration. And so the governor's office does have an appointments page. You can go on there. It lists the various, and there are, I don't know, 30, 40, maybe even 50 different boards and commissions, you know, that run the gamut. And please understand that, like, she makes so many appointments a year because a lot of those positions are rotating. So maybe there's not an open position this year, but there is in 6 months or 8 months. But if we're not in those databases, if we are not present, we can't even be selected. And so I mention that here because you all are leaders already in the community. You're established. You understand what it means to serve on those boards and commissions. And so making sure we are promoting those opportunities that people know. Get your name out there. Put your name on the list. But I encourage you to check out the appointments project, as well as the conversation that they're doing with KU, with the Women's Lead, because I think that they're both conversations about how do we ensure we're voices at the table? How do we build the networks, the resources, the understanding of how to position ourselves to be a part of these boards, commissions, and others that are running our communities and our lives and the policies that are impacting us? And how do sometimes we get the resources and support we need to step out there on faith and actually run? Because that, as we know, can make the difference. So I just wanted to make sure I threw that plug out there, Wendy.
Thank you.
How do we participate in what you're doing?
It's there. They posted it.
Someone dropped it in the link. It's the womenslead.ku.edu, and it is one day next week.
Wednesday next week, yes.
Wednesday next week. And there'll be others. It's a whole panel, but just talking about both business and public sector. So we have participants from both sides talking about leading and moving into these spaces. And we've talked a lot about in that group as we were preparing for next week to also make sure we drop some practical knowledge. Like there's some real things that we can put in there, like what I just mentioned, of not just kind of the feel-good conversation, but all right, here are a couple sites to check out. Here are corporate resources for you to lean into, because that's the power. The action, not just the inspiration, is the power in us leading. So
absolutely. Beautiful. Glenda, did you have closing remarks? Just applause.
I'm exhausted. I'm exhausted. You ladies are top notch. We really and truly appreciate it. I did get a note from Kathleen Marker, though. Kathleen, you want to say a couple of words before we go? Is she there?
Yeah.
Is she there, Allison?
Yes,
okay.
I'm here. So I was just commenting in the comments section that I was just reviewing a report here, and one of the fallouts of COVID is that in this last 30 days, we saw an increase of clients walking in our door for services for domestic violence and sexual violence, almost up 50% over last month.
Oh, there you go.
So there's work to be done.
Yeah.
Work to be done.
There's work to be done. So I will leave you. Go ahead.
I just want to thank everybody for joining us. I hope you found value in the information that you received, and I invite you back to our event in March. I know that Kathleen has something coming up. You have a Women of Influence.
Women of Excellence. We will be celebrating 33 women in the Topeka community, and we'll be highlighting them. Allison can probably speak better to it than I can. That's her job, not mine. Allison, you want to speak up about the event and give a little bit of detail?
Sure. I was actually just typing it in the chat. I will try to leave a link before we all leave. But if you go to ywcaneks.org, the YWCA's website. You can find out more information. We'll be celebrating on Wednesday, September 16th from 6 to 7 p.m., recognizing 33 illustrious women who get up every day and do the work right here in the greater Topeka community. They deserve so much recognition, especially with their leadership through this unprecedented time. We'll also be highlighting the work of the YWCA during this time, and we will also be announcing our top YWCA fundraisers on that event page with fabulous prizes for our top 3 fundraisers available. So encourage you to check out that event. It should be very inspirational and a lot of fun.
Well, Dr. Burns-Wallace, where's Wendy? Is Wendy still here?
Yes.
You both are always welcome to come back, share information. I have been getting so many pings on what a great day of conversation we just had. And, you know, it seems like it was more than an hour, really, because of the substance. And so anytime you have anything to share with us, please feel free to give us a call, ask for a forum, and we'll give you an audience. Thank you so much. We really appreciate it.
Thank you.
Oh,
You're getting hand claps, hand claps. So as I don't know if it requires much more closing than what Ms. Belinda has delivered, but I will say to each of you, thank you, thank you, thank you. To our presenters, we appreciate you. Hats off to you. Thank you for sharing nuggets with us that will definitely grow in parts of us. So I thank you for what you have allowed to flow from you today. And I leave the audience with the question: what's flowing from your reservoir today? You all be blessed and stay safe. Mask up.
have a good evening. Thank you.